Hi, ladies and gentlemen. It's Dr. Julio Novoa. So I wanted to follow up on a post that I made related to the cost of breast implant removal. So at one time, or eventually, every woman that has breast implants placed is going to consider either swapping them out for a different set of implants, or finally, as she gets older, will decide, hey, listen, is it time to just take these implants out and be done with implants, or what are my options? And I get this question asked all the time because many of the patients that I placed implants in more than 10 years ago are already deciding, well, is it time to replace them or is it time to remove them? And my older patients, of course, that are already in their 50s and in their 60s are considering just removing the implants rather than replacing them. And here's a very important part of consideration of breast implants and the use and placement of breast implants. You always have to consider that eventually you're going to have to make a decision on what are you going to do with these implants, because as I keep telling patients and the general audience, implants are not forever. Saline implants will eventually leak, and silicone implants will eventually leak that silicone out of the membrane, the shell. And unlike saline, which is absorbed through the body, silicone is not absorbed by the body, and therefore will start to migrate, seep through the semi-permeable membrane of the shell, and eventually past the capsule that's created around it by the human body, eventually ending up in adjacent tissues such as the breast tissue itself, or in the axilla, or in some cases even as far as the arms or the lymph nodes of throughout the body. It's not unheard of. You can read the literature on it. And as I've already stressed, no implant is forever, especially and including gummy bear implants, which is why I've made this post. Again, no implant, including the gummy bear implants, are forever. You can look that up, and any doctor that says that they're forever or you don't ever have to remove them is giving you false information. Look it up, FDA, or even the American Society of Plastic Surgeons. They all list it there. Implants are not forever. So if they're not forever, what are you going to do when it's finally time to remove them? Well, you can do that. You can do one of two things in general. Either you can remove the implants with the capsule or remove the implants without the capsule. So as an awake procedure, awake implant removal is generally associated with just removal of the implants and leaving the capsule behind. And there isn't really any need to remove the capsule unless you're dealing with silicone implants, and especially if you're dealing with the leakage of implants or the rupturing of an implant, you may want to consider just removing the entire capsule along with those implants. But for saline implants, for example, it's considered safe to just remove those implants and leave the capsule behind. The cost related to implant removal, plus or minus or including the capsule remover, is significant in cost differences. As an awake implant removal without capsule removal, the starting cost is $1,500 for saline and $2,000 for silicone implants. In general, on average, the cost of doing these under general anesthesia can run you as high as $5,000. So you always have to keep that in mind when you get breast augmentation, that if you're eventually going to have them removed, it's going to cost you $5,000 to have them removed. And the reason that I bring this up is because I think that plastic surgeons and cosmetic surgeons should provide a professional courtesy to all patients that have breast implants and offer to remove them at cost. So at cost is about $1,500 for saline and $2,000 for silicone. I think that that's fair. The incisions can be very, very small, 1 to 2 centimeters in size for saline, much bigger, 5 to 7 centimeters for silicone. Recovery time is excellent when done awake. Less than just a few hours. You walk out of the office, you're wrapped, you take it easy for a few days, and you're good to go. Silicone, a little bit the incisions are a little bit bigger, and therefore you have to be a little bit more careful. But when you remove the capsule, which again is important under certain circumstances, when you remove that capsule, you're going to need a lot more time to recover. There's a lot more potential risks of infection, bleeding, the pain and chronic pain complications associated with capsule removal, especially in women that have had the capsule removed as far associated with capsular contracture, or women that happen to be thin. If you are very, very thin and you have that implant on top of the muscle, it may not be possible to remove your capsule because your capsule is embedded in the associated breast tissue and skin itself. All of these things are important to discuss with your plastic or cosmetic surgeon. But the bottom line is this: I think that as a professional courtesy, surgeons should be offering the removal of breast implants as a professional courtesy at cost. Again, at cost is an awake procedure with leaving the capsule behind. Starts out at $1,500 for saline, $2,000 for silicone. And that's my comment for today. Now, I'm going to extend this comment relating to the necessity of removal of silicone implants in another post. I've posted a few, but I'm going to continue this discussion on why even the gummy bear implants are, in some cases, dangerous to keep them in past the 10-year mark, regardless of what you've heard. Thanks so much for watching. Take care.